Have you ever wondered why we feel pain? It's a question that has intrigued scientists for centuries. Today we're going to delve into the fascinating world of physiology pain, an essential, albeit often unwelcome part of our human experience. Pain, in its most basic form, is our body's alarm system. It's an intricate network of nerves, receptors and signals that work in unison to alert us to potential harm. When we touch a hot stove, for instance, it's the searing pain that prompts us to snatch our hand away, saving us from more severe damage. But pain isn't just about physical sensations. It's also deeply intertwined with our emotional responses. The pain of a heartbreak, for example, can feel as real and overwhelming as a physical wound. This dual aspect of pain, physical and emotional, makes it a complex and intriguing subject of study. When it comes to the types of pain, there's quite a variety. Acute pain, for instance, is sudden and short-lived. It's your body's immediate response to an injury or illness. Then there's chronic pain, which lingers for weeks, months, or even years, often outlasting the original cause. In addition, we also experience somatic pain, which arises from the skin or muscles, and visceral pain, originating from our internal organs. And let's not forget neuropathic pain, a result of damage to the nervous system itself. Each type of pain has its own unique characteristics and triggers, and understanding these differences is key to developing effective pain management strategies. So why do we feel pain? It's our body's way of telling us that something isn't right. It's a signal that prompts us to take action, to seek help, or to rest and heal. It's a protective mechanism, designed to keep us safe and healthy. Pain, as unpleasant as it is, serves a very important function in our body. It's a mysterious, complex, and vital part of our existence, a paradox that we're still unraveling. And as we delve deeper into the science of pain in the upcoming scenes, we'll uncover even more of its intriguing facets. So stay tuned as we continue our journey into the mystery of pain. To understand pain, we need to dive into the human body's complex machinery. Our nervous system, comprising the brain, spinal cord, and nerves, is the body's information highway. It's responsible for transmitting signals back and forth between the brain and the rest of the body. Now, when it comes to pain, this system plays a pivotal role. Imagine you accidentally touch a hot stove. Instantly, nerve endings in your skin, known as nociceptors, sense the harmful temperature. These specialized sensory receptors are the body's first line of defense against potential injury. They detect harmful stimuli such as extreme heat, cold, pressure, or chemical changes. Once the nociceptors detect something harmful, they spring into action. They convert the harmful stimulus into electrical signals, a process known as transduction. These electrical signals then travel along the peripheral nerves to the spinal cord, and from there, they ascend to the brain. This journey is a rapid-fire relay race, a testament to the body's incredible efficiency. When these signals reach the brain, that's when we consciously perceive pain. The brain processes these signals in various areas, each with a different role. The somatosensory cortex identifies the intensity and location of the pain, the anterior cingulate cortex handles the unpleasantness, and the prefrontal cortex deals with thoughts about the pain. But it's not just a one-way street. The brain also sends signals back down to the area of injury, often resulting in a reflex action. Think of yanking your hand away from that hot stove before you even realize it's hot. That's the brain looking out for you. Now, this is a simplified explanation. The science of pain involves a myriad of factors including genetics, emotions, and past experiences. It's a complex interplay of signals and responses. But at its core, pain is a survival mechanism, a warning system designed to protect us from harm. So, pain is essentially your body's way of communicating with you. Not all pain is the same, it varies in duration and intensity. Now that's a statement that rings true for anyone who's ever stubbed a toe or suffered through a long-term illness. But what exactly are the differences in pain that we experience? Well, broadly speaking, pain can be classified into two types, acute and chronic. Let's start with acute pain. Picture this, you're in the kitchen chopping vegetables for dinner, and you accidentally nick your finger with the knife. Ouch, that sharp, immediate sensation you feel? That's acute pain. It's your body's way of saying, hey, there's damage here, pay attention. Acute pain is directly associated with tissue damage and is typically short-lived, lasting for a few seconds to a few weeks. Once the injury heals, the pain subsides. It's a vital part of our survival mechanism, alerting us to potential harm and prompting us to take action. On the other side of the coin, we have chronic pain. Chronic pain is a bit more complex and enigmatic. It persists for longer periods, often extending beyond the normal healing time of an injury. It may last for several months or even years. The tricky part? Sometimes, chronic pain doesn't have a clear or identifiable cause. It might be the result of an ongoing condition like arthritis. Or it could occur without any apparent reason, persisting long after an injury is healed. Why does this happen? Well, it's believed that in some cases, the pain signals in the nervous system malfunction, continuing to send pain messages to the brain even when there's no ongoing tissue damage. This can result in a constant state of discomfort, impacting a person's quality of life significantly. So, acute pain and chronic pain, while both uncomfortable, are quite different in nature. Acute pain is immediate and protective, a direct response to injury. Chronic pain, however, is persistent and often mysterious, sometimes occurring without a clear cause. Understanding the difference between these two types of pain can help in effective pain management. By distinguishing between acute and chronic pain, we can better tailor treatment strategies, leading to more successful outcomes in pain relief. Ever heard about the gate control theory of pain? This theory, developed by Ronald Melzack and Patrick Wall in the mid-20th century, revolutionized our understanding of how pain works. It presented the idea that our nervous system has a gate-like mechanism within the spinal cord that either inhibits or allows pain signals to travel to the brain. Imagine your body like a grand castle, and the gatekeeper of this castle is the gate control system in your spinal cord. When you experience an injury, the affected tissues send distress signals, like frantic messengers rushing towards the castle gate. But here's the catch: the gate doesn't simply swing open for any and every messenger. The gate control theory suggests that these pain signals are not given a free pass to the brain. Instead, they must first get past the gatekeeper. This gatekeeper is influenced by a variety of factors, including the intensity of the signal, the source of the signal, and even signals coming from the brain itself. So, let's say you stub your toe. The nerve endings in your toe send a signal to your spinal cord. But if the signal isn't strong enough, the gate stays closed, and the pain message is essentially turned away at the door. But what if the signal is strong enough? Well, the gate swings open, and the pain message is allowed to continue on its journey to the brain. And that's when you feel the sharp, sudden pain of a stubbed toe. However, it's not always as straightforward as that. The brain can send its own signals down to the spinal cord, influencing whether the gate stays shut or opens. This is why distractions or strong emotions can sometimes lessen the perception of pain. This theory has greatly influenced our understanding of pain and how we manage it. It has led to advancements in both pharmacological and non-pharmacological methods of pain management, and continues to be a foundational concept in pain research. Pain, as it turns out, isn't just about the physical injury, but also about how our nervous system and brain respond to and interpret these signals. Knowing about pain is great, but what can we do about it? Pain management is a critical component in healthcare, bridging the gap between understanding pain and actually doing something about it. It's about more than just popping a pill and hoping for the best. It involves a comprehensive approach that addresses both the physical and psychological aspects of pain. Let's begin with non-pharmacological methods. These are strategies that don't involve medication. Physical therapy, for instance, is a common approach. It focuses on improving mobility and function through physical exercises. It can be particularly useful for managing chronic pain conditions, such as lower back pain or osteoarthritis. Another non-pharmacological method is cognitive behavioral therapy, or CBT. This is a type of psychological therapy that helps people change their thought patterns and behaviors. In the context of pain management, CBT can help patients develop coping strategies to manage pain and reduce its impact on their daily lives. Now, onto pharmacological treatments. These are the medicines we use to treat pain. Analgesics, or painkillers, are the most common type. They range from over-the-counter options like acetaminophen and ibuprofen to prescription drugs like opioids. It's important to note, though, that these medications should be used responsibly. Long-term use of certain analgesics, especially opioids, can lead to dependence and other health risks. In some cases, a combination of both pharmacological and non-pharmacological methods might be the best approach. This is often referred to as multidisciplinary pain management. It involves a team of healthcare professionals working together to develop a personalized pain management plan for each patient. Remember, pain management isn't about completely eliminating pain, but reducing it to a level that allows individuals to live their lives as normally as possible. It's a delicate balance, taking into account the severity of the pain, the patient's overall health, and their personal preferences and goals. Pain management is a crucial aspect of healthcare, aiming to improve the quality of life for those suffering from pain. With our current understanding, what does the future hold for pain research? As we delve into the future of pain research, it's clear that we're on the cusp of unprecedented advancements. Today, scientists are exploring new pain relief methods that go beyond the traditional approaches. They're looking at how we can use technology, like brain imaging and virtual reality, to not only understand pain better, but also to devise innovative ways to manage it. Imagine a world where pain relief is as simple as donning a VR headset and immersing yourself in a tranquil environment. Sounds far-fetched? Well, that's the beauty of the future. It's full of possibilities. But it's not just about developing new methods of pain relief. Researchers are also working to unravel the complex genetic factors that influence our perception of pain. By studying these factors, scientists aim to answer a key question: why do some of us have a higher pain threshold than others? This line of research could lead to groundbreaking discoveries that change our understanding of pain and how we manage it. Additionally, the future of pain research is moving towards personalization. No two people experience pain in the same way, so why should their pain management plans be identical? Researchers are developing personalized pain management strategies that take into account the unique genetic makeup and lifestyle factors of each individual. This means that in the future your pain management plan could be as unique as you are. But as we look to the future, we must also remember that the field of pain research is constantly evolving. What seems cutting edge today might become obsolete tomorrow. That's why it's crucial for researchers to continue pushing the boundaries, questioning the status quo, and exploring new avenues of study. The road ahead is long and full of challenges, but one thing's for certain: the future of pain research holds great promise for improving our understanding and management of pain. And as we continue to explore this fascinating field, we can look forward to a future where pain is no longer a mystery, but a condition we understand and can manage effectively. The future of pain research holds great promise for improving our understanding and management of pain. So, what have we learned about pain today? We've dived into the fascinating mystery of pain, unearthing its elusive nature and how it's more than just a physical sensation. It's a complex interplay of our body's sensory system, our emotions, and our unique individual experiences. We've explored the science behind pain, understanding how it's essentially a warning system, alerting us to potential harm. Pain is our body's way of telling us something is wrong, and that we need to take action to protect ourselves. We've distinguished between acute and chronic pain. Acute pain, typically sharp and sudden, is a direct response to an injury or an illness, while chronic pain is persistent, lasting months, sometimes even years. It's a constant reminder that the body hasn't fully recovered. We've delved into the gate control theory of pain, a groundbreaking concept that revolutionized our understanding of pain. This theory proposes that our nervous system can regulate the pain signals traveling to the brain. It's like a gate that can either let the pain through or block it, influenced by a variety of factors from physical to psychological. We've discussed pain management, how it isn't just about popping a pill, but a holistic approach encompassing medication, physiotherapy, cognitive behavioral therapy, and even alternative treatments like acupuncture. Each individual's pain is unique, and so should be their pain management strategy. We've looked towards the future of pain research, a promising field full of potential breakthroughs. From new painkillers with fewer side effects to innovative therapies harnessing the power of the mind, the future holds exciting possibilities for those living with pain. But remember, all these scientific theories and treatments wouldn't mean much without empathy and understanding. Pain in all its forms is a deeply personal experience. Remember, understanding pain is the first step towards managing it effectively. Stay curious, stay informed.